let's talk about Ibogaine. It's hallucinogenic. It was recently mentioned on Joe Rogan podcast with like the governor of Texas, Rick Perry, discussing it mostly for veterans, right?
Yeah.
I looked at the study they mentioned. It's published in Nature Medicine. So that's like, even when I was in academic medicine, if I were to get any paper published in Nature Medicine, I would be like, I've made it. Like, there's not much topping that.
There was a TED Talk on it too.
Was there? I didn't see the TED Talk.
Yeah.
So did you get to look up that paper?
I didn't look up the paper, but the TED Talk kind of goes over a lot of the results and stuff. Governor Perry actually talks about how his wife like went and got treatment in Tijuana.
Yeah, going to TJ for hallucinogenics is kind of insane, especially coming from like a pretty extreme conservative.
Yeah, that's what he
Republican.
says. Is like he is such a conservative, and like, you know, especially talking about these psychedelics. And
I didn't have to even mention it. Like growing up, it was just like, those are the people that are fighting any legalization of any type of medicine. Yeah. So like he repeatedly states it. It's like, oh no, I know what your political stance has been your whole career. Yeah. So it's like, coming from somebody like that, it's pretty profound. So I was looking at the research until this one. Majority of the research is about substance abuse. Yeah. And breaking addictions. Like we've talked about like semaglutide assisting in that, and even things with like cocaine, crystal meth, tobacco, like semaglutide as an adjunct to cut the substance abuse is like very effective. Yeah. But that just gives you like an added percentage chance of being successful. This stuff just seems to be like, okay, you know, just make sure you take it safely and you're good. And it's decades old research that it's just like going back, and all of it, like the results are pretty crazy. Like, how effective it is.
Well, Governor Perry was saying his wife she was on, was it Celexa? And he's like, she wouldn't be able to stay a day without it. And like, she got the treatment over a year ago, and she hasn't taken a single Celexa without any of the mood changes. What is Celexa? Celexa is like a
SSRI?
Yeah.
Okay. Yeah. So that's another thing I wanted to get into is, so it's been studied for a while for substance abuse. Yeah. Kicking habits, stuff.
Do you know
how
it was found?
No.
Do you know who discovered it?
No.
So it was like, it's actually pretty interesting because it's like a 19-year-old heroin addict, and and like his friends like, oh, try the stuff. It's, you know, you're gonna trip for like 3 days. Took the stuff, and he woke up and he's like, you know,
I don't have an urge.
Yeah, he didn't have an urge to take heroin, and he hadn't taken it for a few days, and he was like, oh. And then he started, you know, having other people try it in the addict community that he was with, and they were having the same effect. And that's where it took off. And it's like from some bark of some tree from like Central Africa or something. It is like it's a psychedelic drug, but with appropriate dosing.
It's appropriate dosage, and making sure you have the right people looking after you.
It does slow down the heart rate.
Exactly. It's like, but a lot of medicines people take have that QT interval prolongation. Yeah. So like
your antiemetics.
A bunch of things that like any like cardiac meds are on. Yeah. A lot of the psychiatric medications, they come with that label. Yeah. If you supplement with magnesium, it supposedly like brings that down to like very low chance. Yeah. And the dosage for it to have these like clinical effects are much lower than like what it's going to really take to like stop your heart or slow your heart.
And so what's made it hard for, it to become mainstream, it's an old drug, but they made it a class 1 drug, which made it impossible to do any research studies or anything with it.
It was just deemed that it has no clinical effects.
Yeah, no clinical effect.
The thing though is like this whole time, like we say this whole time, I hadn't heard about it since recently, and then like just like dove into it, and it's just like, the addiction problem is huge, especially like trying to get out of the opioid epidemic.
Yeah, which is the biggest problem with the oxycodones and stuff. And it's just being able to kick that.
That's one main thing.
Yeah.
And there's a lot of people that fight addictions with liquor, where alcohol, where even if it's not clinical, it's still like you're probably drinking more than you should.
Yeah.
But outside of that is how many people are on antidepressants, anti-anxiety medications? Because like a lot of like what they talk about is for like veterans. And a lot of times, a lot of medicine comes from Department of Defense, and like whether it's surgical or medical, it's like, okay, these are the people that need it most, which they do. They're the extremes. But it's so applicable to your like everyday working class female or male that's like just you're just prescribed Cymbalta and get on your way.
Yeah.
You never think of like, okay, what are
it doesn't really cure anything.
Maybe mass disorders. I really don't think it does that good of a job.
Well, obviously not, since like our veterans are, you know, committing suicide 20 plus a day.
Any of the medications we have for any psychiatric disorder, I'm not saying like disease, like disorder, like you're just off a little bit, whether it's anxiety, feeling depressed, like stuff like that. Not to mention like schizophrenia.
Yeah.
Do we have a good medication for schizophrenia?
Oh, no.
Like, no. You might be able to like shut somebody's brain down so much that they don't think at all, but like,
and especially
worthwhile?
With psychiatric issues, we got to find cures. We can't find, and we got to have stuff that, you know, you take a shot or a pill that, you know, is going to be effective for months at a time, instead of like something that you take every day. Because,
for the rest of your life.
Just look at the people that are doing it. You know, you're either building an addiction in someone that's already depressed or anxious and stuff, and like taking these medications. For the drug companies, it's great. You know,
it's perfect.
They're just making hundreds of $millions a month on just the one drug. Forget about all the rest of them that are out there, and like it's compounded with so many people taking it. So
it's kind of crazy how like ineffective it is, how lucrative it is. Usually most systems, like you have to be pretty effective to be lucrative.